Well, good afternoon. I'm Hamilton County Mayor Tim Coppinger. We're doing our weekly briefing that we want to keep the public informed of where we are with vaccinations, testing, and anything that may be related to COVID-19. I also want to encourage people once again that if you have questions that are not answered today, submit your questions and to Ms. Barnes's office, and they will answer them in all likelihood on the next week. So I am joined today with our health administrator, Becky Barnes. Again, I want to commend our health department for the great job that they're doing. I also want to remind people that the vaccine is in big demand, and we've been very, very fortunate. The state's been very cooperative in getting vaccine to us every week. And as soon as that's made available to Becky and her team, they put up the appointments, and we've had some smooth operations at all three sites. We did for the first time last weekend use the Enterprise South Nature Park site. All went well there. They were also able to do again 200 shots per hour, just like they do at the Carter Sports Barn and Bus Barn and River Park. So again, this operation is getting better every day, and look forward to being able to get more vaccine. I will say this was kind of an unusual week in the amount of vaccine that we did receive, which afforded opportunities to do, again, both first doses and second doses. So we're really excited about where we are. And I know Becky will probably talk more to that, but we have been able to administer about 71,000 vaccines here in Hamilton County. So again, you can see we're moving through the process as quickly as possible. One point I want to make really clear today for those out there that are struggling to meet their rental payments due to this pandemic, the Tennessee Housing Development Agency is offering some assistance. We did release that yesterday, but I want to make sure that any opportunity you have to pass this along to someone that may qualify, that you do so. And this is for COVID relief, rent relief application. And the portals will open on March the 1st. It's March the 1st of 2021. This is to pay past rent and utilities that will be covered, and future rent payments may become eligible. The best way to find out about this information is to go to the website, which is thda.org, and check to see if you're eligible or if you know someone that may be eligible. We have a lot of people in our community that's been hit hard with this COVID, maybe lost their jobs or whatever and aren't able to pay rent. And this is a program that's available through our state government, and want to pass it along. Again, the webpage is thda.org. You can also call 844-500-1112. That's 844-500-1112. So again, check on this to see if you're eligible for it. It goes all the way back to the 13th of March of 2020 when we first had our first case, I believe, here in Hamilton County. And so it's based on 80% of the area's median income, but read carefully what the fine print says about the number of members in your family and about the income, because I believe when you get into 4 members of the family, that income can be as high as $58,000. So I want to encourage people that may need some help to do that. So our numbers with the COVID are continuing to remain steady. We'd like to see them go down more quickly. But in the last week since we last talked, what I think, and maybe Becky would concur, that we haven't seen a decline, but we haven't really seen an increase. On average, the numbers have been pretty consistent. So again, we're relying on you and the public to be able to help us to get those numbers down. And again, how do we do that? I know you may be tired of hearing it. I'm not tired of saying it because I know it makes a difference, but you got to wear your mask, socially distance, try to avoid gatherings, large or small, where you're not familiar with the people that are there, and do good personal hygiene. Wash your hands frequently to try to avoid any of this. So again, the update on our vaccine, and I should defer to Becky. Maybe she can speak to it a little more in detail, but we continue to primarily we're getting Pfizer vaccine, but we do get some Moderna vaccine. And if you're paying attention to what's going on the federal level, it looks like Johnson & Johnson sometime in the near future will become available. And we're all excited about all three of them seem to be ramping up. So hopefully we could be in that group. Again, the vulnerable groups and the people that we're addressing right now are 65 and older that are in certain phases, and Becky can share that with you. But we did get into phase, I think it's 1B or 1C, that includes teachers. And as a result of that, I mean, obviously, you know, there are teachers that are getting the vaccine or will be getting it through one-to-one, which is their healthcare provider in the public schools. But we want to encourage teachers that they can simply still go online when we have vaccine available and sign up for it. So again, we know it's important and critical that our teacher population is treated, because we know that it's important to keep our young people in schools. So right now, again, you know, we reach out to you to tell you that we're dependent upon you to continue to help us, and we'll want to continue to pass along the most current information. But keeping in mind that even some of our data that comes down from the state is a little bit slower than if we're posting it ourselves from our local data. So with that, I'll turn it over to Ms. Barnes, and she can answer the latest questions that we've received and share with you additional information. Thank you.
Thank you, Mayor Coppinger. And today I'm really going to talk about just one question that we've gotten, but it's a fairly large question and has several components. So in the recent days, we've been asked about how we store and safeguard vaccine. Let me say first that we take this very seriously, our role in vaccine management. We understand how important it is to our community and acknowledge that accidents can happen, but we are trying to do everything we can to put safeguards in place to minimize that risk. So let me talk a little bit about vaccine safety in that we predominantly get Pfizer vaccine. And you've probably all heard that Pfizer vaccine needs to be stored at super cold temperatures where it has to be used in 5 days. We have purchased an ultra cold freezer, but it has not been delivered yet. So in the meantime, Blood Assurance has loaned us one of their ultra cold freezers. We are so appreciative to Blood Assurance. This is a great example of how our community is working together. Blood Assurance has been an important partner to us in this pandemic from the very beginning. So the freezer that they've loaned us, before the freezer is even allowed to hold vaccine, has to be tested for 5 days, and it has to perform all of the metrics for 5 days. The freezer has a temperature monitor on it and alarms if there is a significant fluctuation in temperature. There is another monitor inside that continuously monitors the temperature, records it, and calls staff 24/7 if there is a temperature excursion. If the alarm goes off, the data is downloaded and reported to the state to determine the integrity of the vaccine. The room in which the freezer is stored, is secured and has limited access through an electronic access card system that monitors entry into the room. The freezer has a generator backup in case we lose power, and that generator system is tested every Tuesday. Staff record and monitor expiration dates of the vaccine continuously. So I want to talk about inventory management. Only vaccine for the next day's appointments are thawed in a refrigerator the night before. If for some reason we cannot have that event the next day, there are still 4 days to use the vaccine. In order not to draw up more vaccine than is needed at each pod site, staff continually monitor any no-shows to reduce the amount of vaccine being prepared. Staff are in constant communication with each other to maintain awareness of the number of doses needed throughout the day. First doses, so when we receive vaccine for first doses, they are appointed as soon as possible after it arrives. Usually that is the same day, and most appointments are within 7 days receipt of the vaccine. We typically use that vaccine within a week. Second doses are also appointed as soon as the vaccine arrives. Now I want to talk about wasted doses. All wasted doses must be reported to the state, and we continually do that. To date, there have been no doses that have been wasted due to expiration of the vaccine. We have had 24 wasted doses out of the 38,277 doses that the health department has given. 13 of those wasted doses were to syringe malfunction. And typically what happens is the syringe leaks. It leaks between the barrel and the needle. The vaccine runs down the barrel. You can't know how much you've lost, and so it's a wasted dose. 11 of those have been due to sudden movements, and the vaccine either runs down a patient's arms or is injected into the air. Some people have fear of injections, and right about the time you stick the needle in their arm, they jerk, and so sometimes, like I said, it runs down their arm. So those are considered, of course, wasted doses. So these are the things that we've detailed to you, some of the steps that we're taking so you understand that we are doing all we can to safeguard the vaccine that we give, that we get and are responsible for in our community. Thank you. Back to Mayor Coppinger.
Thank you, Becky. So as you just heard, we're really proud of the fact that we know that throughout the country, you hear from time to time where vaccines are wasted or stored improperly or whatever. Again, the emphasis is that our health department, and particularly under Becky's management, that has not been the case here. We have not wasted vaccine as a result of any of the management of the vaccine. It's just the, as she said, the way that sometimes that people move and they don't get the vaccine in their arm, or as a result of a malfunction of the syringe. And, really proud of the fact that we have really minimized the amount of waste. So I would dare to say that probably anywhere else they are experiencing the same thing. It's just part. And I think if you talk to doctors in doctor's office, they would tell you that that's they experience it from time to time, even with flu shots or other shots they may try to do. So really proud of the fact that this vaccine program has been extremely well managed, and that we are moving along at a really good speed. For example, this week, we're able to make appointments for about 4,300 new doses. And then I believe, looking at my numbers, I think 4,900 second doses. So, that's bumping up against about 10,000 doses being able to make appointments for. And again, as Becky said, we want to thank our partners and volunteers that help to make this work as well. Obviously, the health department has got an extremely intense labor requirement there with their people. But, again, it's made possible to put these many shots in arms because we do have some volunteers, even internally with the county government. Our emergency management has filled in, as well as people in our engineering department or in our public works department in general, highway department, HR, anywhere that where people can volunteer to help. They've really stepped up to do this, and this is extremely critical. It's a really important, obviously, to issue to all of the citizens of Hamilton County. This pandemic is something that we've got all hands on deck dealing with, and want you as the public to have confidence in what we're doing, and the fact that we want to be transparent with you and share with you some of the things that you might want to know. And I know that's one of the things as Becky chose today, people talking about the waste of vaccine. And again, we're very proud of where we are right now. So we look forward to next week's, to any questions that you may have, and that helps to educate all of us in Hamilton County as to what's going on. But until then, again, we want to continue to decline the number of active cases in our community. We're a little over 1,100 right now. I think it's 1,157 as of yesterday. So we want to get that number down. And again, our hospitalizations, are a lot better than they were. They were up a couple from the first of this week. So that always is something that gets my attention. So we want to keep people out of our hospitals. And so for any of you that are 65 and above or in these phases, please come out and take this vaccine. Nobody's telling you you have to, but we do know that it's going to make a difference for you, for your family and your loved ones. And it's going to help increase your odds of not getting this unbelievably contagious virus that has come through our community and done a lot of damage, left us with the loss of a lot of people, and a lot of people that's been extremely ill that are still recovering. And again, this goes across all demographics, ages, race, ethnicity. It's just really important to know this virus does not discriminate. This virus is in our community has attacked any and all. So again, respect it, don't fear it, wear masks, socially distance, and we'll look forward to seeing you again next week. Thank you.